going to continue with our dissection. We had some technical difficulties. I believe this is the pulmonary trunk, and in order to show you the branches off of that, which would be our right and left pulmonary arteries, I think I need to cut some more on this side. So we really are going to dissect this thing pretty well. And hopefully I can show you a little bit better what that is. It's kind of hard when they're so dense. Okay. Well, here you can see, you really see the pericardium here. You can see how it's just like a skin that covers it. And in here we have the artery that I just cut. And off of that, there are branches. Pulmonary. You can see one of them right there. There's a left and a right. Okay? Left and right pulmonary arteries. You can really get a good look at the different layers here of the heart on the outside. That's pretty interesting. And let me see what else we need to do here. Our aortic arch is right up in here. You can see here the opening of it. And let's use this so I can show you how it opens. Okay, that's our superior vena cava. Travels down, goes down to inferior vena cava at the other end. I'm having a hard time locating the veins. It looks like they're really densely in this one. It's all the same color. It's hard to tell which is which. But we've got a great cardiac vein that's supposed to be down. Let me see if I can figure it out from this way. The coronary arteries are supposed to be in here. I'm going to see if I can get the tissue apart. Just get underneath without cutting them. But we've got, it looks like that might be it there, the great coronary artery. Unless this is it. It's one of these two. And then it goes down into the small cardiac vein and the right coronary artery. The right coronary artery is located inside the coronary sulcus. Let's see if we can't find that. I think this sheet must have been old or sick because it seems like it's really a little bit atrophied in some spots. Either that or it's been preserved for a long time, I'm not sure. I think that's one of them right there. You can barely see it. Let's see if I can get this back. It sure does look like there's a lot of fat around this heart. You can see that fatty deposit? I don't think that's supposed to be there. Maybe that's normal in sheep, but I don't think you want a fatty heart. That looks like one of the veins right there. Okay, can you see it? Got one. Now let's figure out which one that was. There should be another one over here. might just be one of the bigger veins or arteries. And of course, if it was, I just ripped it. Looks like tissue. It's kind of hard to tell. Okay, so I think we've got our bicuspid, tricuspid, your semilunar valves. So showed you there's two of those. There's one in the aorta. There's another one in the pulmonary vein. I'm sorry, the pulmonary arteries. And let me see, the right and left atrioventricular canals. I think that's what they are in here. You can see them. Little canals in there. Can you see that, Rach? There's your ventricles. Got a right and left canal. Okay. And I do believe the only thing that I couldn't really find was that right marginal artery. I'm having a hard time with the arteries. I'm not sure if that's even what this might be running alongside here. Ah, wait a minute. Here we go. It looks to me like that is definitely one of them. You can see it. See that little hole? There's one. There we go. I knew it was over there somewhere. Okay, you've got another one here. Another one here. You can see it over here, the little hole. Those are your veins and arteries. Okay, see that right there? Now you can tell. There and there. Okay. And that does it for our sheep's heart. It's been very interesting. Have a good night.